Oh, hello, welcome back. In this segment, we look at the lower extremity, what we typically think of as legs, but again, we're going to refer to as lower extremity from this point forward. So we begin with the pelvic girdle. Just like your upper extremity had your shoulder girdle, here in the lower extremity has a pelvic girdle to connect to the vertebral column. Now, think about that discussion we had about flexibility or freedom of movement and stability. Here in the pelvic girdle, because you're supporting the weight of the upper half of the body, we've given up some of the flexibility for stability. So your pelvic girdle is much more substantial and less mobile than your shoulder girdle. Okay. Now, if you look at the pelvis, there are two halves to the pelvis. Each half of the pelvis is referred to as a coxal bone. And then that will join with your sacrum. That's the wedge at the base of your vertebral column. And then you have that coccyx or tailbone. Okay. Now, the pelvic bones have deep sockets called acetabula, and that's where the head of the femur will attach. And again, these sockets are a lot deeper because they have to support the weight of the upper half of your body, especially, it's much greater forces if you're running or jumping, things like that. The pelvis itself creates this sort of bowl shape that supports abdominal pelvic organs like intestines, bladder, uterus, things of that nature. All right, now the pelvis, or each coxal bone, is actually made of different bones that have fused together. There's the ilium, the ischium, and then the pubis. The ilium is sort of the flared part of the pelvis up at the top, and you can actually feel that like the side of your hip. That's referred to as the iliac crest. So you can find that. That's sometimes used as a landmark for giving kids shots in their hips because gluteal muscles will attach at that ridge of bone. So the ilium is the ridge at the top of the pelvis. The ischium is at the front here where the two halves combine. I'm sorry, I messed that up. Your ischium is what you're sitting on. So like the part of your pelvis that forms like your sit bones, that's the ischium. And then the pubis is at the front where the two halves of the pelvis connect. Okay. Let's see, the sacroiliac joint. So there's your sacrum, there's the ilium. This joint is locked in place. That's not a movable joint because, again, we have to give up flexibility for stability in that joint. So whereas your shoulder girdle has much more movement or range of motion, your pelvic girdle doesn't. Again, we said the ischium is what you're sitting on, so it narrows sort of into a V-shaped notch. And the spines of this help form what's called the pelvic outlet. We'll look at that in just a moment. There is also a sciatic notch back in the pelvis where the big old sciatic nerve passes. Okay, the pubic bone, again, that's at the front of the pelvis. It's connected, or each half is connected by a vertebral disc that's called the pubic symphysis. So this is a fibrocartilage disc that allows just a little bit of movement between the two halves of the pelvis, but not very much at all. Okay. So again, the pubic symphysis is basically a disc between the two halves of the pelvis that allows just a little bit of movement. That's more relevant like during pregnancy if you need to have a little bit more flexibility in the pelvis during childbirth. The acetabulum, again, that's the socket. Again, that's a fairly deep socket into which the head of the femur inserts. And again, it's a much deeper socket than the glenoid cavity in your shoulder, but that's reasonable because you got to support that weight of the body. Sometimes people have acetabula that are a little misshapen, or the head of the femur is a little misshapen, and so that pushes the head of the femur out a little bit, and then that's when people get like hip dysplasia. All right, so looking at differences between male and female pelvises. If you look down here, here are the ischial spines. Again, the ischium is what you sit on. So this space in between the spines is called the pelvic outlet. The pelvic inlet is this ring at the base of the pelvis. So the inlet and the outlet are passageways for the head of a baby during childbirth. So because females will have children pass through that passageway in the pelvis, Relative to the overall size of the pelvis, females have relatively larger pelvic inlets and outlets. Additionally, if you look at the pelvis from the side, sorry, it's just taking things up here. You'll notice that in females, the sacrum is a little shorter and a little flatter. And again, the idea there is it opens up the pelvic outlet a little bit more for the passage of the baby's head. So again, you can imagine in a female pelvis, the sacrum and coccyx, it'd be a little shorter and a little flatter to maybe open up more space in that pelvic outlet. Additionally, the ilia, those are the two big sides of the pelvis. In females, they're a little more forward facing or opened up. And again, that's to make room in the abdominal pelvic cavity for a developing fetus. All right, moving down into the lower extremity. What corresponds to our arm bone or humerus is the femur, which is the thigh bone. It also has a rounded head that fits into the socket of that acetabulum. It also has a surgical neck. And then it has these big rounded areas of bone here called trochanters. These trochanters, you can palpate one on the outside of your hip. Again, if you're moving your femur around or your thigh around, you can feel like the attachment point to your pelvis. That trochanter is found there. And those big extensions of bone are what muscle attaches to. So when you see big processes on bone, muscles attached there. Let's see. Another thing that's sort of interesting about the femur is that it's canted medially, which means our femurs aren't straight up and down. Our femurs sort of move toward the midline. So when we walk, our feet are actually under our center of gravity. So our femurs cant toward the midline, so that as we walk, our feet aren't off to our sides. That's how chimps walk. Chimpanzees have straighter femurs, so they sort of waddle from side to side as they walk. When we walk, because our femurs are canted, our feet are more under our center of gravity, so we're more efficient as we walk. Let's see, down at the base of, or the distal end of the femur, you have these big pads. They're called condyles. So there are two really big pads or condyles at the distal end of the femur, and that helps form part of the top of your knee. You also have a groove in there for the patella or the kneecap. All right, now moving down into the leg. The leg is made of two bones. In the same way your forearm has two bones, your radius and ulna, your leg has two bones, the tibia and the fibula. Now, the tibia, it's the weight-bearing bone in the leg. It makes up the bottom half of your knee, and it's your shin bone. So again, you can feel your shin, and that's your tibia. On the proximal end, you do have those big pads, those condyles. Again, those make up part of your knee, and that bears a lot of weight when a person runs and jumps. Also, again, in this joint, you have the kneecap. All right. And again, the tibia bears most of the weight. The way I remember this, I think the fibula is like a little faker off to the side. Okay. So the fibula is sort of like the radius in your forearm. It's the more lateral bone. And again, they're held together by interosseous membranes. And the extensions of the distal ends of the tibia and fibula, they make up your ankle. So the bump on the inside of your ankle is called the medial malleolus. That's the distal end of the tibia. And the distal end of the fibula is your lateral malleolus. So that's the bump on the outside of your ankle. So we did like the tibia to femur ratio stuff. You did the lateral malleolus, which is just an approximation of the end of your tibia. But again, this basically creates a cap or a cup-like structure to accept your ankle. All right, now moving down to the foot. Again, this corresponds to the wrist, palm, and fingers. Instead, we have tarsals, metatarsals, and phalanges. So how do you keep carpals and tarsals straight? I just think tarsals are bones associated with the toes. So tarsals are with toes, okay? And they are built to try and support the weight of the body and help propel us along. Now, the bone down in your heel, this is called the calcaneus. Now, the calcaneus will connect to this tarsus bone, and that actually sits up in the cup of the tibia and the fibula. So these bones making up part of the ankle actually fit up inside the distal end of your leg bones. Then you have the other tarsal bones that we see here. The metatarsals make up the sole of your foot. And then again, we've got phalanges down here. Now, the metatarsals and the sole, they bear a lot of weight for a person. So they are stitched together by all sorts of ligaments to help firm them up. Additionally, when the muscles in the calf contract, it pulls on the calcaneus, and then that pulls on these ligaments in the foot. So if you've heard of people having plantar fasciitis, that's inflammation in these ligaments that help support the arch. So people with plantar fasciitis need to have like good arch support in their shoes. And then finally, we've got those phalanges. Your phalanges have a bony arrangement similar to that of the fingers. You've got 3 bones, except for in the big toe, you've got 2. And your foot is structured for a walking pattern called a heel strike and a toe off. So the idea is when you walk, you strike first with your heel, so that's the heel strike. And then when you do the toe off, most of your weight is pushed through your big toe. So again, you've given up some of the flexibility of your big toe to be able to generate or push with more force as you push off on that big toe. All right. So that runs us through the lower